Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Reading a medical imaging report can feel like reading a foreign language. Words like attenuation, signal intensity, echogenicity, or hyperdensity pop up everywhere. But what do these terms actually mean when identifying real-world conditions inside your body? Today, we are breaking down typical pathologies seen across medical imaging. We will explain how common conditions appear on your scans from a patient perspective, while exploring the physical mechanisms behind pathology signal characteristics for our technologist community. For patients, receiving an imaging report can cause unnecessary anxiety simply because of the medical terminology used. When a radiologist describes a finding, they are describing how X-rays, sound waves, or magnetic fields interact with that specific tissue. Terms like mass, lesion, or shadowing are simply descriptive anatomical labels, not automatic diagnoses. Understanding how healthy tissue differs from fluid, fat, bone, or solid tissue helps take the mystery out of your results. One of the most common findings on routine scans is a cyst. A simple cyst is just a fluid-filled sac. On ultrasound, CT, or MRI, fluid interacts with energy differently than solid tissue. Simple cysts are fluid-filled, smooth, non-cancerous, and usually require no treatment at all. Solid masses, on the other hand, contain cellular tissue and blood vessels, which is why your doctor may order IV contrast to see how blood flows through the area. For our technologist and student community, evaluating osseous pathology requires understanding density shifts on projection radiography. Acute cortical fractures appear as sharp, radiolucent lines due to structural discontinuity. As healing progresses, osteoblasts deposit osteoid tissue, creating a soft callus that gradually mineralizes into a dense, radiopaque hard callus. Recognizing benign stress fractures versus aggressive osteolytic lesions, which destroy bone matrix and decrease X-ray attenuation, is fundamental to diagnostic alignment. In diagnostic medical sonography, fluid and dense structures yield classic acoustic signatures based on sound attenuation. Anechoic fluid is simple fluid, produces no internal echoes, allowing sound waves to pass unhindered and creating posterior acoustic enhancement. Hyperechoic calcifications are dense gallstones or kidney stones reflect nearly 100% of the sound beam, creating bright leading edges followed by dark, posterior acoustic shadowing. On computed tomography, tissue characterization relies entirely on linear X-ray attenuation measured in Hounsfield units. In acute ischemic stroke, an intravascular thrombus appears hyperdense due to high hemoglobin concentration. As cytotoxic edema develops, sodium-potassium pump failure drives fluid influx into brain cells, decreasing tissue density and resulting in hypoattenuation and loss of gray-white differentiation. In MRI, pathological tissue identification relies on relaxation times driven by hydrogen-proton environments. Most active pathologies, such as inflammation, muscle tears, infections, and edema, contain elevated extracellular water. Because free water has long relaxation times, inflammatory lesions appear hypointense on T1-weighted sequences and hyperintense on T2-weighted and fat-suppressed STIR sequences. Neoplastic pathologies alter surrounding tissue microenvironment through tumor angiogenesis. Rapidly growing malignant tumors develop chaotic, leaky capillary networks. During dynamic contrast studies across CT and MRI, malignant masses typically exhibit rapid early arterial enhancement followed by central necrosis or delayed capsular washout. Identifying these vascular patterns helps radiologists differentiate malignant tumors from benign hemangiomas or fibroadenomas. Understanding how pathologies present across different modalities allows care teams to choose the most accurate, lowest-risk scan for every patient condition. By matching clinical symptoms with precise physical signal characteristics, medical imaging empowers doctors to monitor treatment progress, confirm complete healing, and deliver personalized medical care. Whether it is a simple fluid cyst or complex vascular tissue, medical imaging provides a clear, non-invasive window into body pathology. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.